do some cancer survivors, I should ask then, have reconstructive surgery right away?
Yeah, that's a great question, Olga. It really depends on the cancer. When you're talking about, say, a head and neck tumor, you can't leave somebody with a large defect in their jaw, for example, because it would really impair their ability to feed themselves and to really function. When you're talking about breast cancer, patients generally have the option of doing it at the same time or doing it after the treatment for their cancer. And there are advantages and disadvantages to both options. We do have a lot of data about the satisfaction when you have breast reconstruction immediately and you have breast reconstruction after the, the mastectomy and the subsequent treatment. And the data shows that the satisfaction tends to be a little better when you do it delayed because they've lived without a breast and they see that dramatic change where when they do it immediately, they're kind of expecting to be restored to their exact pre-mastectomy image, and it sometimes doesn't happen that way. But you have the advantages of doing it all under the same anesthetic and having one recovery rather than two. So it's a very personalized decision.
It's a personalized decision, and that's what I was thinking right now, where a woman decides for herself, and I'm sure she has the conversation with you, doctor. Yeah. You talked about some benefits, some risks. Are there any other ones? You mentioned the anesthesia. Obviously, you're already under, so I guess getting it done while you're already under could be better.
That's one of the real benefits.
That's a huge benefit.
Yeah.
Any other risks that may be involved in terms of waiting?
No, there are risks involved in doing it immediately.
Okay, and what are those?
Because when you're doing a mastectomy, you're taking away a lot of the blood supply to the skin, and which is typically preserved as the envelope which we fill to do the reconstruction. So there are more complications when you do it immediately because of the lack of blood supply to that skin versus when you do it later, the skin has had time to recover its blood supply and you generally have less complications related to wound healing and related to the skin, part of the skin dying and things like that.